So bright in here. Hey guys, Davison here. Okay, this is the first time I've gone live sitting here in months. I don't even know what I'm doing. As you can see, my eyes are not as they normally were. They feel frozen. And what's going to happen as I do this broadcast is that I'm going to go in and out of functional neurologic disorder seizures, psychogenic seizures, meaning I have no control. I have no control over what my face does sometimes. I have no control over what I say sometimes. Sometimes I'm going to speak funny, but it's because I have what they assume. I have a stabbing headache. Hold on. I have what they presume right now is a functional neurologic disorder, which means that something attacked my brain at some point in the last 8 months, and it is now causing it to misfire. So what is wrong with me is not a hardware problem, but a software problem in my brain. So if I move funny or act weird, this is called dystonia. I don't have any control over it whatsoever. And I go in and out of it. So what it feels like when I have an attack, which I'm having in my neck right now, it sometimes before it happens, I feel this kind of whoosh in my head. That's the best way I can describe it. Oh my God. And my stengendiga, now I'm not going to be able to talk right. Oh my God, this is hell. Imagine being me when I get in dinga. Imagine being me. I'm going to fight it. Part of this live broadcast is therapy, but what doesn't sort of make sense about their diagnosis, if you're looking at me, is I still look very sick. The doctor was very nice today, and I trust his opinion greatly. But he said it's because on the scans, they can't see anything wrong with my brain, that they have no choice but to discover but to say that I have what is known as a functional neurologic disorder. So my symptoms are real. It just means that they have a very hard time. They have a very hard time explaining this. They're still doing research on it, but my brain for some reason is misfiring. And so on and off, my brain stops working, which is why my muscles won't work right. My eyes do weird things. I can't speak, but I can understand. And another thing that rules out it against it being another thing ruling out against it being the CJD, the mad cow disease, like I thought, is the fact that I can still understand what's being said to me, but I can't understand. But sometimes sometimes I can't talk. And he said that what helped with therapy, okay, now I'm going to have aphasia again. What helped with therapy is just do normal thing. So I try do normal thing, even though it's very hard for me to do normal thing. This has been very bad, as I never understand, as you can probably understand. That it's really hard to have the brain to ding in the bunga. What? It's not mental illness, Ricky Murray. There's a doctor, a neurologist who has more qualifications than you. He's Dr. Albie Richard, MD, PhD, neuroscientist. I think Ricky Murray, with all due respect, he's more qualified to make the diagnosis than you. Have you been to school for 14 years? I don't think so. No, it's not mental breakdown. It's not mental breakdown at all. It's functional neurologic disorder diagnosed by 2 neurologists, one of which has multiple titles and probably 14 years of education. So we're going to just put that aside in a box, put it over there. Maybe you are maybe you well-intentioned, but you don't know what you talk about. Right now, when I talk like that, that's aphasia, meaning I can but I ningen bingen. I understand, but I can't talk right sometimes. And I never thought this would ever happen to me. So if you think in your life that nothing bad will ever happen to you, that everything always going to be perfect, mind you, what happened to me only probably happened in a way to 30% of people in neurology clinics, but not like this, not complicated like this. Chance of this happening to someone 1 in a million. And it's hard on me because I just, as I normally talk right, and now I can't talk right. It's very hard on me. It not mental breakdown. If mental breakdown, why able to laugh and smile? No, not make sense, Ricky. No mental breakdown. Normal cry if you know talk properly. Normal cry. Very normal to cry. My brain hurt. I hate the light. Oh, stabbing head. I'm having. So by the way, the doctor also said that I have a leak in my brain. So I am currently leaking cerebrospinal fluid from my nose. He's pretty sure, but it's not a severe leak because they would have seen it on the CT scan. Instead, it's a leak that's going to have to patch on its own over time. If it doesn't get patched over time, they have to do neurosurgery on me. So, again, I'm not crazy. I had a brain infection, which then led to functional neurologic disorder and a leak in my nose. Oh my God, do you read that? Efrain, did you read that? Read it, Efrain. Read what Ricky just wrote. Efrain is my moderator and my friend. My symptoms about it's not a fair assumption to assume that I'm mentally ill. I'd say that no mentally ill person gets dystonia. This is called dystonia. Look it up. And now, oh, look, the fluid's dripping from my nose again because we love to have a leak. We stand a leak in our sinuses that drip brain fluid. And I still have a sense of humor about it too, which is pretty remarkable. Okay, hold on. I vingen dingen vegen diggy. I need to get a Kleenex. I get in the In fact, I was hurt by a diagnosis of this being in my head because they put me on medication that I never should have been on. So now I'm in the process, as spinal fluid leaks from my nose, I'm in the process of getting off my medication because I never needed to be on it. That said, part of the viral illness that I had was heightened. What did I just say? Oh my God. Part of the viral illness that I had, or whatever it was, my anxiety got worse and worse. And I actually was cut off from my personality until about the end of July. So what that means is that I couldn't feel happiness and I couldn't feel sadness. I will never be able to explain that experience to someone. I've been through neurological hell. Let's just say that in a way that helped me when I was hospitalized in a mental facility in the psychiatric ward twice. I have spent 2 months now as an inpatient in psychiatric hospitals, or actually more than, I should say, I don't know if I should pluralize it or not, but it's predominantly one, but a shorter time in another, because they couldn't figure out what was going on with me, and therefore presumed that my insistence there was something wrong with my brain was me being inaccurate about it, when in fact I was accurate the entire time. But also when my personality was cut off and I had heightened anxiety, they wanted to treat that. When they treated it, I had an adverse reaction to the medication the first time, which led me to have seizures and spasms and be babbling and incoherent like you see me now. So they didn't know what to make of that. And maybe they're well-intentioned. So they put me on because I couldn't tolerate SSRIs, they put me on a lower dose of a certain medication, which might have made my movement symptoms worse. So they tried to, my anxiety has gotten better, or my personality has come back online. So like literally 3 weeks ago, I was like, oh my God, I can move again. I can feel again. What the fuck? And I mean, once I am more, recovered, I will make a talk. I will try to do a TED talk about this, because this is the story of my life, of a lifetime. I mean, most people will never experience what I went through, with their brain shutting down in different areas of their brain, and gradually their brain comes back online. I mean, that is an extraordinary thing to go through. Again, the odds of this happening to someone are 1 in a million. It probably will never happen to you, and be thankful for that, because this is not something anybody wants to go through, nor does anybody want to get. By the way, I still have a leak in my brain, which is why I get stabbing headaches, and then cerebral spinal fluid leaks from my nose. So I'm not 100% better, and I have to take it easy, but I have to also try to be myself again, because what I have to do, I have to retrain my brain to function normally. So I have to do repetitive things. I had already been doing repetitive things when I was sick. I was doing brain games when I had no personality and I couldn't feel. All I could do was think. So it was like half my brain shut down, and the other half that was left was logical and calm and rational and very intelligent, which I was like, oh, I'm intelligent, but I had no feelings, which I can't explain the experience of that, but actually in a way, I actually miss not having, I miss not having feelings, because when I didn't have feelings, this was less painful to go through. Can you please turn down the volume on that? That's very destructive what you're doing right now. Turn down the volume on your video game. It's hurting my head. Thank you. Sorry. Can I close my door then? Please close your door, because you should turn down Max, wear earphones. Max, I'm talking to my son. Sorry. I'm going to mute this. Sorry about that. If I seem on edge too, remember, my brain misfires. So even though my personality is back online, I'm way more emotional than I normally am. That said too, there is still a possibility that this very well-educated man, and he said this, is not right, and that there is still something else going on with me that they haven't figured out yet. So please bear that in mind, that even though they believe that it's a functional neurologic disorder with a leak in my sinuses, maybe they haven't figured this out yet, and I might get sicker. So I'm just warning you guys that this is what we know or have been decided as of today. I really wish I could. By the way, I wanted to move out of here. I was literally about to buy a house, and then I got sick in January, very sick. And by the way, to my credit, I worked on Patreon for 3 solid months while I had no personality. I couldn't feel, I couldn't think. I was a complete fucking mess, and I still produced content with my nude body, I might add, while that's sick. So I fought to try to get better on my own, and I fought to try to keep working. But for the meantime, there will be no more Patreon, because I have to take it easy. My brain is leaking, and I can't always control what I'm saying, or my body. My body does stuff like this. Like right now, it's deciding to do this. This is dystonia. So I go from being, but I get into, okay. Let me read what you guys have been saying. Okay. Ketosis is supposed to help with epilepsy. Yeah, that's what the doctor had said today. Oh my God. Am I still live? What is happening? Okay, sorry. My son put a ding. Oh no. I might have an epilepsy. I might have seizure. I'm going to have a seizure, so I have to lay down. Hold on. Oh, okay. Thank you. Thank you. Oh no, I hate this. This is torture with the lights in front of my eyes. I wish the bungin. I did not. I was asking Max and I asked Max to put up a blind because I can't tolerate this light that's in my face. It's so bright today. Hold on a second. I'm in and when I get the seizure, I get confused. You guys see that? I know I can't take rest because I do and don't do anything. But again, I never get to live a normal life, and I want my life back. I just want to be normal again. Max, hold on. Andreas, can you put a blind in front of my face? Would get the paper blind if you put it there because the light is too bright in front of my face. I can't walk right. Hold on, guys. I'm gonna have another seizure.
Yeah, I'll be there in a sec.
Okay, just a minute.
So you want a pair one here?
Yeah, I'll put it in.
Do you mind if I take a black one from here?
No, you can't do that. Are there none left? Ask Max if there's any left.
We don't have any more.
Oh, that sucks.
Let me think.
Because
We
it's
can put up
so.
a bed sheet.
No, it's just so bright for my eyes. It's so painful because I get headaches and I get such bad headaches. So I can't handle, and I'm photosensitive because my brain's inflamed. Oh, you guys see how bright the light is, right? Like that's why it's shining on my face. It's just abnormally bright today. It's so painful. It causes me little figgy. I forgot that you had seizures, Eileen. You're still on my wall. I fight. What we know about Davison is that she fight really hard and she very fighter. So I fight my brain. I brain personality thinking lots of different parts of brain. So I work really hard to be able to do the things that I do. Because that's Davison always very strong mentally. That's why Davison able to be successful in career. But not successful enough because there's things that I did wrong in my career. See, look, it's wearing off. I literally can feel a wave of it coming on. I know when it comes on and then the wave goes away. It is the most bizarre experience to go through. It's like this wave of altered consciousness. And they're like, how do you know it's coming on? Oh, you must be acting. No, I can feel literally like my brain's, Eileen, does this happen to you in epilepsy? Because some people get auras. Some people get auras for migraines too. You get a warning. Like my warning is I feel my brain slowing down and it's like it's in this like scrambled wave. And then the wave comes over and I can't talk. I move weird. And then it goes away. And I'm like, okay, I'm back to myself. So it's almost like a computer that's malfunctioning. And there's a part of the script that's malicious code. And then only like it's like when a computer program that is normally functional, like Final Cut Pro, crashes because it encounters some erroneous thing that normally doesn't happen to it. I'm glad I can feel the wave though. It's like a darkness and it feels heavy. Yeah, exactly. So people who don't have epilepsy will not understand this, or people who do not have functional neurologic disorder will not understand. I mean, in my case, not all functional neurologic disorder patients are the same. In my case, when I have a seizure or whatever it is in my brain that gets scrambled, the communication gets messed up. It's like this wong, like I can only, how like in Inception sort of feels like the movie, like what I'm going through. I really wish the fucking light outside wouldn't be so bright. I've said this before, but it's driving me crazy. I guess I could turn around. I don't know if but I know I can't because I don't think right. I don't want to knock the computer stuff on me and hurt myself. Fuck you, light. And my blinds aren't like, it's just unusually sunny today. It's normally not this bright in here. But again, guys, there's a possibility, because I am having some sort of seizure, that they still haven't figured out what's wrong with me. And I have some sort of brain infection that is causing swelling. And that's why, because what I don't get, and even though I just cried, is like my face doesn't look right. My eyes don't look right. I look sick. I mean, I am sick. I don't know if you guys have any thoughts on this. I'm trying to make it exposed for my hand instead of exposing for the light. Plus, it blocks the light. That's what I'm doing. Oh, God, I'm not thinking right. I'm having another wave. Oh, my God. I got to lay down. Hold on. Maybe I can do this. Can we do this? Maybe we can do this. Is that better? It's not really better. Oh. I really don't feel well, guys. So this is facial dystonia. Hemifacial, not paralysis, but half my face spontaneously won't work right. Can you imagine living with what I'm living with? Anyone? I mean, Eileen can because she has epilepsy. But imagine spontaneously parts of your body don't work right. Oh, and look at how bad the IV is. The vein is actually hard. And that I told them that it would hurt me when they put the IV in. And they're like, it's fine. I'm like, I don't think so. And then now I have this huge blood clot here and it's killing me. And I have, by the way, I have bruises from having so many seizures. I have bruises everywhere. That's from the IV. Where's the bruise on my elbow? There's a bruise here. Oh, look at my knees. I'll show you my knees from having so many seizures. I've got huge bruises everywhere because I've fallen on the ground so many times. And by the way, the Glen Hospital made me have seizures on the floor, telling me I could control it. I literally had seizures on the hospital room floor. So I've been through hell. This is the worst hell I've been through in my entire life, and I have been mistreated and misunderstood. I have great compassion for everyone now, not that I didn't before. Somebody didn't turn off the tap, right, Andreas?
Yeah.
Can you turn off the tap in the bathroom? Someone didn't turn it off right.
Oh, sorry, you have to repeat that.
Can you please turn off the tap in the bathroom because somebody didn't turn it off right?
No problem.
Okay. And by the way, this isn't mental illness because not a single person on the planet could do this to their own face. It's impossible. It's like I'm having a stroke because my brain is literally having kind of a stroke right now. And I mean, I encourage people to share this because this is crazy to go through. You see, my face is, it's just decided to be kind of like a stroke right now. Oh God, it doesn't feel very good. I'll tell you that much. So Eileen says, twice it literally felt like something crawling up the side of my neck on my face and distorted it. The people in this facility don't care. Oh no, so they're not treating you right even though you have epilepsy? I'm sorry. People like us are frequently mistreated. And by the way, now I have a disability. I never had a disability before. I didn't have a disability. I was normal. Oh yeah, I was saying, hold on. I was really strong before all of this. And now my face is going to get messed up again. Why are my eyes so red? Okay. I can smile, see? But it's gone down. It's the muscle right here that spasms. So it pulls your face like this. So I get these muscle spasms that it just pulls my face in a weird position and then it goes back down. And that's also proof that it's not a normal movement disorder, because in a normal movement disorder, or if it was a stroke, it would be permanent, but it comes and it goes as it pleases. And by the way, if this was the 18th century, they would have called me a witch by now and drowned me. Or if this was the 1950s, they would have given me a lobotomy. So let's be happy it's not the 1950s. Yeah, I accept that I'm disabled. It's okay. I'd rather be disabled and alive than dead. I just can't do Patreon. And part of me didn't want to do Patreon anymore before I got sick because I'm tired of showing my body. I'm really tired of it. So people were going to have to accept that on Patreon, they pay $15 and they get what I did. What I did is great. And maybe I'm going to change my mind. Maybe when I get better, because I still love men. I'm still a huge flirt. I'm still very open-minded. I'm still body positive. I still think that women should be able to be edgy without people always assuming that it's porn, right? There's a spectrum, right? Everything falls on a spectrum. And I never did sex acts. There was just nudity and comedy and body positivity in my work. And I think, again, there's a strong social value for that. Plus, it's very lucrative, to be perfectly honest. It allowed me to save up enough money that I've been able to take, time off, even though that money was going to go to buying me a new house, which, by the way, I need to move because I've said this before, they don't maintain this apartment well enough, but the rent is very cheap. And I have a carpet beetle problem. And carpet beetles are terrible because it's very hard to get rid of them. So I do still need to work. But that said, back to what I was saying about Patreon. I can't do it anymore. I can't do it like this. What I'm going to be showing you guys my titties and be like, I'd say the answer to that is the big fat no. Anybody have any thoughts? Because a lot of people are watching but not saying anything. So let me just go back in the chat. It's hard for me to scroll because Max changed the mouse when I was gone because I was away at the hospital for so long time. Okay, we already talked about Ricky, Blue Spirits laughing. Ketosis, yes, the brain is made of fat. So yes, I should eat more fat and less glucose. I also need to get off the medications I'm on. Patching bone means you need vitamin K2, the K4 version. Okay, I will. Thank you, Sam. If you're still here, Sam, thank you. No, I'm not doing this as a YouTube personality stunt. I just proved that half my face was spontaneously not working. I had rather make a sex tape and go viral than go through what I'm going through right now. It would be easier for me to get a lot of attention doing a sex tape than it would, and which I don't want to do, and I've never wanted to do, than to do this. This is the most elaborate fucking stunt that nobody would want to go through this. Nobody. I know it's a crazy story because, like I said, the chances are 1 in a million of this happening to someone. But there's a lot of other ways that I never would want to do that I would do before I do this to myself, right? And when I have seizures, you've seen them. You try to get your spine to contract like that. Try for 1 minute straight or 2 minutes straight. Impossible. You can't do it to yourself. You would have to be like a marathon level athlete in spinal contortions. I am not a marathon level athlete in spinal contortions. So we're setting that aside. So John Dongan Jingan Nongan. Fuck. Dongan. My face is doing the thing again. So let's just live with it. So it's relieving to see you getting some answers. Yes, I have a neurologist. I forgot what time I have an appointment again, but I will call them back. I'm supposed to have a 24 EEG that somehow has gone missing. So I will call the clinic. Actually, I should call the clinic before they close. I believe they close at 4 p.m. Let me just see if Jonathan wrote me back. Again, I invite you to try talking out of the half of your face like this. I invite you. It's impossible. Look, I'm going to smile. I'm smiling. You try doing that. It's impossible because it's caused by involuntary muscle contractions. Okay, so let's see when they get ding and ding and ding and ding and ding and ding. Oh, I got to call them back. That's involuntary too, by the way. Hold on. I ding and ding and Max and ding and ding and I get a Kleenex, okay? Max? What? I get a Kleenex. What? I just tell you I go bathroom. Okay. What? I can't blow my nose too hard because I have a leak in my sinuses. So it'll make the leak not seal if I create too much pressure in my head. So I have to make sure that I don't lift anything heavy, and I have to have caffeine, and I have to take it easy so that the leak in my brain, the leak in my sinuses, it heals. And I'm going off of medication that I'm on that could be making this problem worse. You're welcome to ask me any questions, by the way. Okay, so do you feel any better than 2 weeks ago? In some ways, yes. In some ways, I get more of a window where I'm more my personality, and it's very overwhelming for me to have my personality come back. It just went down. I didn't have emotions. I couldn't. Oh no, I'm getting ringing in my left ear. And now I'm getting goosebumps on my left arm. It's really overwhelming to have been cut off from your emotions and then to have them come back, because your brain's now like, it's going, already my brain is scrambled because it's not communicating with with all the parts, are not harmonizing and not communicating properly. So already it's dealing with that. And then to deal with the sudden onset of me having feelings and a personality again, it's again, unless you go through it, you'll never fully understand, but it's something else. And like I said, I was trying to say, and I never finished that part of my story, is like, I preferred actually somehow why not having as many feelings, because I've realized that I am emotionally dominant in my personality. So my brain misfiring has led me to realize that I as a person, my emotions come before my logic. But for a while I lived logical. And that's why I wish that I would have been born a man, because men seem to, and this is controversial and it's sexist and it's unintentionally so, but I feel like men are more even keeled when they're not enraged. Although men do have feelings too. Let's be perfectly honest. But you have more control in life when you're even keeled, because what I've noticed also too, with my feelings coming back in all of this, is that nobody likes a woman who is upset and cries, which is really sad. That's a lot of internalized misogyny. But yes, to conclude, there was something nice about not having any feelings, but it's probably better that I have them back, because not being able to laugh is kind of painful. Because whenever I try to laugh for months, I would experience that as physical pain. Again, unless you experience it, you never understand. So it was like, I'd be like, I try to smile, and in my head, it would hurt. What? And when my personality came back online, I was in the ward at the Jewish General with a friend, and he was very nice to me. Thank you, Nachman. I know Nachman, maybe you're not watching anymore, but Nachman and I were spending time together, and I was like, oh, I feel different. Like, again, back to the waves that this does to me. I was like, Davison is back. By the way, I also kept telling the nurses that would come visit me at my house, because they also set me up with long-term nursing care before I got hospitalized the second time. Again, I'll have to eventually tell this whole story in a linear way, because I went in the hospital, then they sent me home with nurses, then I went back into the hospital because I didn't get better when the nurses were here. What was I saying? Oh yeah, I kept telling the nurses, Davison is dead. Like literally. So by the way, too, the emotional side of my brain is Davison. The logical side of my brain is Amay. Does that make sense to anyone? It should. It makes sense to me now that I've gone through it. So Davison died, but Davison came back. So Davison is now alive again, which is weird and overwhelming. This is like, again, it's worthy of a TED Talk that's very well written and very well thought out, because very few people will ever experience what I've gone through. Or TEDx. Let's not presume I will make it to the heights of TED. Okay, back to what you're saying. Oh, crap. I hate this. I need my trackpad back because I can't scroll through your comments. So I answered Bartholomew. Have you been tested for COVID? No, I have not. And there's a theory that it's COVID. Thank you, fucking COVID. That was sarcasm. It's COVID that caused this. So I had the symptoms of COVID back in January. I had nighttime defecation. So I had diarrhea, which happens to some people. I had neurologic symptoms. I had a cough. And then I went on to have severe neurological complications, which happens to some people who get COVID. So it's very possible. And by the way, my boyfriend, who's now my ex-boyfriend, who is sometimes not my ex-boyfriend, he's like this boyfriend that I have on and off. I love him, but we don't get along very well sometimes. He got COVID. He had COVID. They tested his blood for antibodies and he has COVID, and he got pneumonia twice. So somebody who I spent time with had COVID. So let's do the math. Let's check the odds. Odds are I got COVID. It attacked my brain, and now I'm recovering from it. And the pressure in my brain is what led partially to the fact that I have a leak in my sinuses somewhere that's dripping cerebral spinal fluid. Because my brain got inflamed, created increased pressure, which then led to a leak, which is dripping down my nose right now. So the doctor, neurologist today told me to go ask to get serologic testing for COVID antibodies. And I'm going to put money on the fact that I have them. I should probably be on antivirals right now, guys. I mean, I could bring that up with him too, because this has persisted for a very long time. Okay, so wish you a recovery. Thank you for being darling. I'm looking better than yesterday. Well, that's the thing. This comes in waves. Sometimes I'm functional. Sometimes I'm dysfunctional. Sometimes I'm functional. Sunshine can be good. No, not when you have brain swelling. When you have brain swelling, sunshine and light is really painful. And right now, light is very painful for me because I'm photosensitive, because my brain's inflamed. If you don't have a shade, do you have lower wattage light bulbs you can change them to? What? There's no light in here. No. Normally my apartment isn't this bright. It's just uncharacteristically bright today. Like very, very, there's no cloud cover, I can tell. Yeah, you're right, Danny. Oh shit, here we go again. That's another thing. I had no sense of humor for, I guess it was for 7 months. I had no sense of humor. And when I was in the hospital, the other patients, by the way, there's a misconception that people in psych wards are all stupid and dumb and crazy. No, there's also different levels of care. I was in the lowest care ward because I'm not a danger to other people. I'm not a danger to myself. I'm calm. I'm a nice person. So a lot of other people there. There was I spent a lot of time with geriatric people. One woman who's really awesome. Her name is Helen. She's part of the Raging Grannies, which is a political group for older ladies who get political change because they're seniors and they're taken more seriously because they're grandmas, which I think is really cool. I think it's awesome to be called a raging granny. I hope someday to be a raging granny. I hope I live that long. But they were like, wow, wow, Amy, or Amy, because I told them to call me Amy. They're like, wow, Amy, you're so intellectual and so rational. And meanwhile, it was because half my brain wasn't working. Meanwhile, Meanwhile, it was because the dominant part of my brain wasn't working. But that was nice of them to say that I was so intellectual and so cool and calm. They're like, you're just so smart and you put things so well and so calmly. Yeah, because I had my fucking brain wasn't working. I think Efrain's probably laughing right now. Oh, I'm tired of seeing Ricky Murray's comment. Being disabled isn't so bad. Okay, yes. I'm taking gabapentin. I'm so sorry, Eileen. I'm sending love to you. That's all I can do. It's just like, I appreciate the love I'm getting here. I'm about to get twitches on the left side of my face, by the way. Thank you for calling me beautiful, Rafaela. I'm less beautiful than I used to be because I'm all fucked up. What about trying to therapy? Well, I have a therapist. I have a team. I have a giant team of medical professionals following me now. Let's just, you can't be this fucked up and not have doctors following you. At least there's that. So yes, I have someone who's my therapist. I have another therapist I'm about to see. I don't need to, like, in a way, because I'm so resilient, I don't need, by the way, so this is what the doctor saw today too, that he's like, finds so fascinating with my functional neurologic disorder, that it goes from one side of my face to another. So now it's the muscle here is pulling. So before, my brain decided to make it pull on this side, and now it's deciding to make it pull on this side. Violated foods. Oh, it's working. No, it's not. No, it's not. Okay. I just have to wait it out. It'll go away. Oh, that's painful. Hi, Jane. Oh. Never get larder beetles. They're almost impossible to get rid of, and their bites are really nasty. I had them for several years. Well, I have to move the fuck out. I again interrupted myself. I was about to buy a house when I fucking got sick, and I fucking need to get out of this fucking hole. Even though it's cheap to live here, it's only, well, it's not that cheap. It still costs with electricity about $1,000 a month. But I can't live here anymore. It's not helping me emotionally. Just like I can't be in the relationship I was in anymore, where he's my boyfriend, but then he's not here, but then he's got issues, but I've got issues, but we don't meet. He wants to be this, I want to be that. We go this, we go that. It's like enough is enough, you know? Like, I don't think that him and I are meant to be together. So it's fine. Like, I think I should let him go and I should move, but I couldn't do any of these things while half my okay, now I'm going to do that. It's dystonia. I have no control over it. This is embarrassing. Hold on. Oh. I want to stop doing that. The medication that I'm on could be making this worse, because people who are on antipsychotics or even antidepressants for long periods of time can end up with dystonia. And you pull weird grimaces and weird faces involuntarily because you're part of your brain, dopamine. There's not enough dopamine in a certain part of your brain. So it starts to make your body malfunction. And I think it has to do with acetylcholine as well. Sorry, I shouldn't. Oh, that was probably so loud for you guys. I'm sorry. I'm going to read what you said. Have I looked into fasting? Yes, I was fasting before all this started. Right now, I've lost so much weight that it would be a really bad idea for me to fast. John says SSRIs are hell. They are hell. They're terrible. I also suspect that I've had a bit of serotonin syndrome because I never needed them. They had me on a monster dose of Zoloft. They had me on 150 milligrams of Zoloft. I didn't need it. And I kept trying to tell them, like, I don't need this. And they're like, no, you lack insight. You need this. Pat, pat, I can't afford to alienate anyone, so I won't state my actual opinions about some of the care I received until I am better and in a position of power, because all of this has put me in a position of powerlessness, and it has been, again, the worst hell of my life and excruciating. And if anybody out there wanted me to be tortured, I've been tortured for the last 8 months. It's by my body, by my brain, and by medical professionals who were well-intentioned but poorly behaved and didn't believe me, didn't take me at face value. And actually, if I've gotten better since I left the hospital, if I were to sit with them and have a conversation with them as Davison, they'd be like, whoa, yes, doctor, I will not say her name. Yes, doctor, I was poorly diagnosed and completely misunderstood, and you have tons about me wrong. I never somatized, doctor, whatever your name is. And I deserve an apology. In fact, I probably deserve some financial compensation, but I would rather be healthy than rich. But I'd also, actually, no, I'd rather be both. I'm kind. Aren't I so kind? I have so much self-restraint to not say her name. Again, she's probably well-intentioned, but was extremely damaging to me. Sunglasses, yes. Yes, that's exactly it, Efrain. Is this going to work? Is this, that helps a bit. Thank you, Efrain. I love you. Oh my God. I need no better sunglasses. I have them. I got to move slowly because I'm going to fall over. Oh, no, I'm going to have another seizure. Hold on. Oh, God. Oh. Okay. Okay, that was a short one. You know, as horrible as things are, we should hope actually that this is COVID, because COVID combined with rare neurological disorder equals relatable to the general public equals opportunity for content equals content success. If I can prove that I had COVID, which then led to me having a functional neurologic disorder and being misdiagnosed and getting a cerebral spinal fluid leak through my fucking sinuses, that's probably a compelling story that people could sort of relate to. And then I could communicate in a very eloquent way what it's like to suffer. And not only that, the suffering that I witnessed in the psychiatric wards. And a lot of these people suffer because they're over medicated and they're not being properly treated. They throw large doses of medications at these people, these very vulnerable people, and then routinely deny them medical care. It's a tragedy. It's a tragedy. And it leads to huge suffering in a very, very vulnerable population. And so if me going through this means that I can help other people who suffer, then it's worth it. I'm getting another Kleenex. I like helping people. That's why I made, now it's leaking. My cerebral spinal fluid is leaking again through my nose. See, there it is. What was I going to say? I like helping people. That's why I made tutorial videos on this channel that are about TikTok, because I love TikTok and I like helping people. I even like helping people. Patreon is a way of helping men. Oh, see, it's not fully, my face isn't fully normal because look, when I smile, I can feel it. It's this side of my face is a little bit paralyzed. It's not even. I can feel it. See, like when I smile, it's not, both corners don't stick up the same way. Okay, so Don't try starting to. No, I'm not going to be able to talk. Don't try starting. Don't staggin. Don't start trying to talk so soon. I'll get in 10 minutes after my geezers. Yeah. Well, I get seizures on and off all day. And again, the hell that I'm in is that I retain full comprehension of what's going on, but I can't control my body or sometimes my speaking. So imagine it's like having night paralysis. Like if you've got a sleep disorder wherein you're awake, but you can't, or your brain is half awake, but you can't move your body. And then you wake up like, oh my God, which by the way, I had that long before I got sick. I had episodes of night paralysis. I had parasomnias. So I think my brain already had a vulnerability for that. But this is like, when I have these seizures or these spells, I can still read. I can still see how people are reacting to me, but my body doesn't move right, or I'm having a seizure. And I also see nurses laugh at me. That's why I in the live stream, I was suffering so greatly when they kept telling me I could control this and I couldn't. It is cruelty to say to someone who has a functional neurologic disorder that they can control it when they can't. No one would do this willingly to themselves, nor is it actually physically possible to do. I invite you to try. Oh, I'm hitting the table again. I shouldn't do that because then it fucks the microphone up. I invite you to try. And so I was fully aware of the nurses that were mistreating me, including the doctor, but I also equally have had periods where I've been out of it mentally. So I was frantic and I couldn't stop that either because my brain was going like that, there's some sort of weird abnormal electrical activity in my brain, and I couldn't control my emotional reactions. Just like when I had half my personality, half my brain wasn't working, I had no emotion, so I could only control my thinking. I couldn't control my emotional behavior. And now it's very, very, very overwhelming to have both. Because I'm like, now my brain's confused. It's like, I thought you were rational. It's like, no, you're emotional. It's like, okay, no, you're both. And it has to all calm down and come back to being like, normal brain. And apparently I will recover from this. It just might take a year or two. And then I can make my TED Talk. Hi, Dr. Coconut. Good. I'm glad Eileen corroborates. I'm sorry you have epilepsy, though. Lower the brightness on your screen. Okay, that's smart. Oh, no, I can't lower it too much or it's too hard. I'm glad to see you so well again. Was very worried. Yeah, but we're not in the clear. Are we out of the woods yet? No, because I'm still not feeling right. I'm still not acting right. I still feel like my inhibitions are lowered in an abnormal way. I still get terrible facial movements. I still have cerebral spinal fluid dripping from my nose. So no, and also it's still possible that what the doctor diagnosed me with is incorrect. By the way, if you tip me $5, I will do absolutely nothing but talk, because I can't do anything active, because I can't make my brain jiggle around more, because more fluid will drink, then the leak won't close, because they're hoping that the leak just closes on its own. January is not really early, and I would not have needed to be in contact with someone from Wuhan, because coronavirus was going around long before they detected it. So that is wrong, Mr. Feel. Start gobbling vitamin D. Yeah, I have vitamin D today. Daily, I'm now taking turmeric, vitamin D and C, iron. I was anemic, and lion's mane mushroom. And I should have as much fat as I want in my diet, because it's going to be good for my brain. I should, by the Dr. Coconut, I should have coconut oil. I should be lower carb. But right now I lost so much weight from this that it's just good that I eat. Okay. Like eating in and of itself is an accomplishment, because there was a period where actually before I was hospitalized, I wasn't eating. I was down to 120 pounds. I was frail. And now I've gained some weight, which is a good thing, but it's partially responsible. One of the medications I'm on is partially responsible for it. Vitamin D, okay. That's not cheap in my opinion. No, it's not. One day I should do nothing. D is fat soluble and be stored in the fat and liver as long as you get enough. Get it in the sun. Do not use sunblock. Okay, that's good, folk. Sorry if I haven't paid attention to your comments. It's that my setup is bad, so I have a hard time scrolling. China plague? No, don't say that. That's racist. Please don't be racist. I'm glad, Thomas. So David says, maybe I'm wrong, but I noticed that when you get emotionally excited, like when you were begging nurses and doctors to help me, was when you mostly started a seizure. No. Well, maybe, but possibly, but no. There's been this common misconception that my emotions dictate this. No, I don't think so. Because my emotional state, as you saw, like I'm happy, I'm talking to you guys, and then all of a sudden my face stops working like it's doing now. It's doing it on the left side again. Like it that helps triggling. I can't even say triggering. Oh no, not that again. Oh, I should stop. I'll do this. Zinc? Yes, Jane. I should take zinc. You're right. Let me write that down. I have never owned this many pills in my entire life. I probably have like 20 different types of pills sitting on my shelves over there. Okay, but you're saying it gets worse when I'm really emotional. Probably, maybe you're right. Oh God, this is... I've also had problems swallowing too. And for a while I couldn't taste right. I lost my sense of taste and my smelling wasn't good. I lost my sense of smell, which by the way also happens. Okay, I'm having spasming in my throat. Hold on. You hit the like button if you're here, by the way. Don't be afraid to say hello. Ask me anything about the brain. I will tell you what I now know about the brain based on what I've been through, based on my brain not working right. I guess I should probably post this to Patreon, but I don't know. I mean, I don't want to overwhelm people on Patreon. And until I'm ready to go back there, if I'm ready to go back there, again, it's staying as is. And anybody who's a patron, you're just helping me to survive financially because I don't make that much money off of ad revenue here. I was making the majority of my money from Patreon, but you do not have to join. But if you wanted to help me and my family out, that would be appreciated. By the way, I'm letting my friend's son stay here to help him out, and he helps us out too. So there's, at least there's 3 of us in here now. 1Q, are you having double vision? Yes. Oh yes, I forgot to tell you guys. I also got vision damage from all of this. My vision started getting poor. My vision changed in January when I got the viral infection that attacked my brain, of course. And it was blurry. And then gradually until July, I started seeing like a silver circle in my field of view. When I told mental health professionals that, they told me I was crazy, impossible, that I was somatizing. Then I got a retinal scan. And by the way, in my retina, I have fluid at the back of my right eye. So they don't know what causes central serous retinopathy. Here's my proof that I have it. Here's a little sheet that says central serous retinopathy, written by the ophthalmologist. So I have permanent vision damage too, to add to the clusterfuck of everything else. But vision damage is more livable. I don't want to go blind, obviously. But in terms of how I've suffered, it's a minor inconvenience, relatively speaking. Oh, thank you, Scent. I love you too, Mr. Bitchy. Science says, I'm sorry to hear that. Oh yes, back to double vision. When they put me on citalopram, I developed vertical double vision, wherein if I look at lettering on the wall, I see shadows beneath the letters. So now that's since evolved into I still have that. So I see halos of letters beneath objects or beneath lettering, if that makes sense. So say it was written cat, half the C, half the A, half the T would look like a shadow directly vertically beneath it. That's vertical. That's vertical. Yeah, vertical, and that's horizontal. Yeah, vertical. Myasthenia gravis symptoms are very like yours. I should ask that. I didn't ask that to the neurologist. You're right. I never did. This has been so complicated that myasthenia gravis. Shit. Okay, hold on. I have to make a call. This is important.
Super. We will be with you shortly.
Oh, wait, watch that be copyrighted. Sorry this is so
Votre
long,
appel
guys.
est maintenant en première position et le prochain opérateur disponible.
After this, I won't stay online too much longer because it's very overwhelming for me, and I feel all keyed up. Do I hang up? Because this has been ridiculous. I've been on hold for 15 minutes. I'm sorry that I had to make you guys wait this long.
For all other inquiries, please have your Medicare card ready and we will be with you shortly.
Okay, why would they I'm worried that they're not answering because I've had to call them so many times, but I didn't write down my appointment.
Super.
I
We will be with you shortly.
I didn't write down their. Here, I'll turn this down lower. But I'm worried I won't hear the hello. Are they purposely not answering me? I'm being paranoid because I've had to call them a lot, given that I've suffered so much. I've been on hold for 15 minutes and I'm in the first position in the queue. They should have picked up by now. This is weird.
Merci de patienter. Thank you for your patience.
I just want to know. Oh. Okay. I'm in the first position. Oh, this is so much pain. My face is doing the thing. No, my son always lives with me. Why? Well, no, I think they're just busy, but this is crazy. I'm sorry, guys. I'm currently on hold for a medical appointment. Hello? Oh my God.
We will be with you shortly.
I just want to know the date. Sorry, guys. I would have waited, but it's going to close and I need to know the date. It's not for a couple months. Could you just tell me this doesn't make Max? Hold on. Okay, this is Murphy's Law. Oh, no. This is Murphy's Law. I'll just unmute you guys and talk. But then, because if I unmute you guys and talk, then surely the secretary will pick up. Max, stay on hold, right? Sorry, I don't want to yell too loud for you guys. Hold on. I've been on hold for 23 minutes to get the date for my appointment. I know the time, I just don't know the date. It's 23 minutes I'm on hold. That's impossible. I'm ready to hang up.
Merci de patienter. Thank you for your patience. Nous serons avec vous sous peu. We will be with you shortly.
There must not be a secretary. This is impossible. Max, are you still on hold? Hold on. Sorry. It's distracting though, because hello?
For your patience.
No?
Nous serons avec vous sous peu.
Thank you for your
We will be
patience.
with you shortly.
We will be with you shortly. Thank you for your patience. We will be streaming shortly. Merci de votre patience. On diffusera sous peu. Sous peu. And I said sous peu wrong because my face is trishing again. That's involuntary, by the way. I don't want to end this live stream. I probably should, but this closes. Literally, they close in. Comment ça, c'est 25 minutes? I've been on hold for 25 minutes. I'm sorry, guys. This is crazy. Okay, I'll recap in a minute, guys. If you're here, hit the like button. I'm sorry I'm making you wait. I was calling for a very important medical appointment. I thought it would take 5 minutes. I've been on hold for 26 minutes. This is how overwhelmed the system is. Do they just not? Oh. Okay. So, no, I didn't get a receptionist. It sent me to the voicemail. They made me wait on hold for 30 minutes to send me to their voicemail. That was fun. That's a good, not microcosm, not analogy, but sort of, it's a good parable for my experience with Quebec healthcare thus far. neither timely nor accurate, and full of problems, and full of waiting and suffering. That wasn't suffering by any comparison with what I have endured the last 8 months, but there you go. And I want to thank Ephraim. I want to thank Ephraim. I hate this. It's dystonia. I'm literally sticking out my tongue involuntarily, which I find horrible out of all the things that I have. Because the tongue's a muscle. This is why I need to go off the medication that I'm remaining on, stat, because it will only make involuntary spasms like that worse, because it's killed dopamine in the movement part of my brain, which means that I do things involuntarily. I have involuntary movements. It's Parkinsonism and dystonia. Well, it's dystonia technically. So I don't want to randomly stick out my tongue for the rest of my life. So I need to go off of medications that are blocking the dopamine in my brain, which I am, but I have to taper slowly. I just ordered a jeweler's scale. Yeah, they closed for the day and sent me the voicemail. Okay, if anybody's new here, or just showed up, I was explaining that I have been diagnosed with a leak to my, a cerebrospinal fluid leak in my brain that is dripping down my nose. So what that means is our brain floats in cerebrospinal fluid, which is in both our cerebral brain and spine. So due to increased brain pressure, or from the infection that I had, or from the shaking, there's a tiny little hole somewhere, and cerebrospinal fluid drips out. On top of that, because my scans have been normal up until now, and we're saying this in quotation marks because I still have not had a lumbar puncture, I still have not had a repeat MRI, they're presuming that what I have is what is known as a functional neurologic disorder. What that is let me read to you about it. So what is it? Functional neurologic disorder mimics neurological conditions such as epilepsy or paralysis, but the brain's hardware, the structures within the side of the brain, are normal or healthy. They're not technically not that healthy because they're not communicating right, and they're making me do strange things like I'm just about to do. I literally did not show that to you. I really don't. This is. I don't like this one. Of the ones that I get sticking out my tongue is the worst. I can't control it. Okay, we're gonna stop that. Okay, so let me keep reading this. And sometimes I can't speak properly. My throat hurts. I get also throat spasms, which is what this is. In functional neurologic disorder, the functioning or software of the brain is altered, typically by severe stress, illness, or emotional trauma. These alternations. No, I just read the word incorrectly. That was also involuntary. These alterations are reversible, and there's no risk of brain damage. Again, this is on the presumption that this diagnosis is accurate. It is still possible that I'm sick with something that they haven't completely figured out yet. And see, that's another sign that my brain's not working right. Sometimes I say the wrong words. Sometimes I babble. Sometimes my face does what it's just doing right now. Sometimes I have seizures. Sometimes I feel seizures coming on. It feels like a whoosh, and then I seize. I don't feel a whoosh right now. I feel it right now. It's mostly muscular. So, okay. To put it simply, functional neurologic disorder is a neurological reaction to trauma, stress, illness, or intense emotions, or things they haven't figured out yet. They haven't figured out the exact cause of this yet. Functional neurologic disorder symptoms are involuntary and cause substantial distress and impairment. Yeah, no shit. You know, like if you're a YouTube personality and half your face doesn't work right spontaneously. Fortunately, with treatment, most people with functional neurologic disorder, okay, now it wants to do this, learn how to reduce or stop their symptoms. So symptom types: weakness or paralysis, abnormal movements, tremor, dystonia, myoclonus, gait. I can't always walk properly, by the way. By the way, guys, speech or swallowing problems, which I have, attacks or seizures, and anesthesia or sensory changes. So common comorbid conditions in people with functional neurologic disorder that they've uncovered are anxiety, depression, which I do not have. By the way, the last month at the hospital where I was at, they were like, you were depressed. That's what caused this. Bitch, please. You tell me you tell Davison, bitch, please. And I kept saying to them, I'm not depressed. I've never been depressed. I got sick with a viral illness in January, and I've done this weird neurological downward slope until present. They're like, some people with depression are unaware that they have depression. I'm like, bitch, I know my emotional state. I'm not depressed. I have about 1,000 people that can attest to the fact that I was very happy in December, and I was funny, I was productive, I was nude, and then, ouch, now my face is tingling on the left side. And then I fucking got sick with a viral illness, and I just kept repeating my story to them, and they wouldn't listen. They're like, nope, you are depressed and you are somatizing. No, turns out, no, not depressed. Had a viral illness, attacked my brain, got functional neurologic disorder. Let's continue. I'm being repetitive. So, but I did get increased anxiety as a result of all of this, or during this. Oh, the fluid is leaking from my nose again. I got to calm down. Hold on. So also a comorbid, which means a disorder that occurs, or a medical condition that occurs, or psychiatric condition that occurs at the same time as functional neurologic disorder. Anxiety, depression, post-traumatic stress disorder, or panic attacks, which I don't have, other than anxiety. Dissociation, experiences of detachment from immediate surroundings or from oneself. Yes, that happened to me, but it also feels like a seizure when that happens. So it's some kind of weird ass brain misfiring seizure. And alexithymia, difficulty identifying and describing one's emotions. Well, that too happened to me. Like I told you, until the end of July, I couldn't feel more than small things. Like I could still feel love. I could still feel friendship. I could still feel compassion, but I couldn't feel happy and I couldn't feel sad. Bizarre. It was like I tried to draw a diagram actually to one psychiatrist who, again, will remain unnamed, but eventually will be held accountable. I said, I felt like my brain was like this after I got sick. Is everybody still here? I think some people left. So, oh, that sucks. This is my brain. And this is me, my whole brain, right? But then I felt like me was cut off from emotions. And I should show this to the neurologist. I should write this to him. He would be fascinated because he wants to work with me on my case because he thinks it's fascinating. So can you see this? So once I got sick with a viral illness, there was this partition that was put up between me, or who is known as Ame or Amy, and it killed temporarily Davison, Davison is emotion. So there was like this rift, this misfiring right here. And now I feel like my whole brain has come back online. I'm like, whoa, I don't know what to do with this. Davison's back and I'm freaking out, but now Davison doesn't move properly. I feel like everybody left. Am I boring everybody? No, I shouldn't take this personally. Actually, that's also a sign too that I'm getting better, that I'm worried about trivial things like numbers. Like whether or not, usually people have lives and they don't want to sit on a stream for an hour and a half, especially if it's repetitive. So what is the treatment for what I'm incurring? What I'm going through? And that was a misfire too, because I said the word incurring instead of going through. Psychotherapy, targeting emotional and behavioral basis of symptoms. Physical therapy. Physical therapy appears to be helpful for some forms of functional neurologic disorder, particularly in cases of weakness or paralysis. Speech therapy may be helpful for people who have problems with speaking, and intermittently I do. When I have a seizure, I can't talk right and I babble. And medication to treat, medication to treat depression and anxiety. They can take their medications and shove them up their ass, is what I'm going to say, because they're going to kill me. Because psychiatric medications have severe side effects that are not worth it unless you absolutely need to be on them. I do not deny that psychiatric medication helps some people, but it hurts far greater numbers of people than it helps. And the sooner they can get into deep brain stimulation to fix schizophrenia, the better for schizophrenics, especially those with simple simple cases or less complex cases of schizophrenia. Although no two schizophrenics are the same. I learned that too through being hospitalized. Schizophrenia has many presentations, and each is very idiosyncratic. And also too, there was a guy I met in the hospital. This wonderful guy, very handsome. I'll call him handsome. Maybe I'll tell him his name, but nothing happened between us. His name's Eric, not to be confused with my Eric or my ex-boyfriend. The Eric that I met, he's no, maybe I shouldn't say this. No, I can't say this. That would be disclosing his condition, and he wouldn't be very happy with me saying it. So maybe not. But let's just say that he has a condition that I think deep brain stimulation could fix, because he's a normal guy. Like, imagine a handsome, fit, normal guy, but there's just one thing wrong with him that makes him, really messed up. And that was the case for a lot of people that I met in the ward. Normal, like so normal could be, but so varied, so not what you would think, right? Like, we all have these presumptions that people who are hospitalized in psychiatry are all screaming, raving lunatics, when that is absolutely not the case. And every case is different. And every case responds differently to medication. Some people, it helps and they need it. Some people, like me, it hurts them and fucks them up even further because they had something else that was wrong with them. Although I did feel that I needed to be treated for my abnormal anxiety, but now I don't, because my brain has come back online, and I can't seem to tolerate serotonin. Whenever I have SSRIs, my spasms get worse. So there's some link with serotonin imbalance in my brain right now that's causing the misfiring, is my presumption. Again, nobody has proof of this. They can't measure serotonin levels right now, I don't think. Actually, I should write that for the diagram neurologist. Link to serotonin to heightened. GABA makes it better. And I was trying to explain this to the psychiatrist that I know that I have a big problem with. And she was laughing at me, like, because when half my brain wasn't working, like in the diagram, when Davison was dead, Davison is emotionally dominant and secondarily intellectual. Sorry, I have to write this down. So I couldn't articulate, nor did I know at the time what was going on with me. I knew there was something wrong with my brain. I just couldn't articulate it. And me coming up to her and saying, I think there's something wrong with me being intolerant to serotonin, and that GABA, whenever we increase my GABA, I feel better. And she was like, you don't even know what you're talking about. Oh, I hate her so much. I shouldn't tell you guys I hate her, but I hate her so much because she was treating me like I was stupid and insane, and I was neither. Oh, calm. But I was fucked up because I had no emotions at that point. So I was aware of what was going on, but I couldn't articulate my opinions, which were founded based on research and probably a solid theory that she should have more thoroughly considered, given who she was dealing with. And she has no idea, even now, who she was dealing with, because my personality came back online. Davison came back online holistically when she was on vacation. But my goal is to get well first and then hold people accountable second, right? Am I lactose intolerant? I'm psychiatrist, and I'm kidding. That was sort of a joke, but I'm kind of not. There are some great psychiatrists out there. But a lot of them do a lot of harm and they don't realize that they're doing it. And they're so high on their own supply and so drinking the Kool-Aid that they don't listen to their patients when they should. And the modern psychiatric drugs are the modern lobotomies. They are chemical lobotomies instead of physical lobotomies. And I know they are because I went through it and now I'm going off of it. And my neurological condition allows me to be very keenly aware of what they do to the brain. This is, like I said, my story could only have happened to 1 in a million people, and it happened to happen to me. So even if I am dying, I need to get all of this out there as well before I die, so that hopefully someone can take this information and use it for good, because there are good people out there. There's a very great neuroscientist called Norman Doidge who talks about neuroplasticity. Norman Doidge, you are amazing. There's an amazing researcher into how people in the mental health care systems and those who are medicated fare poorer. His name is Robert Whitaker. Please look up Robert Whitaker's talks. He's amazing. I was also suggested 2 other books I should read before I see my neurologist again, who's a very passionate, nice person. And he's like, oh, this is uncommon. Not only do you have functional neurologic disorder, you seem to be erudite. I was like, thank you, doctor. I'm sorry. I can't even believe, is this real life? Like, I sometimes feel like Daniel after dentist. I can't believe that this has happened to me. Like, it defies logic. It's uncomfortable, strange, and intense. And I hope I get back down to, I am Davison again, but I hope I get back to just like this calmer, more neutral, cutesy Davison state. Because actually, even right now, I feel like I'm being too cerebral. I'm cerebral, but something's wrong with my brain. I'm the cerebral paradox. I've encountered a lot of vicious circles and paradoxes recently, my friends, and I'm tingling all over. I don't want to. No. Meds are terrible for the majority of people. They are terrible. Psychiatric medication is, let me make an analogy. A lot of the time, not all the time, because you're right, psychiatric medication works beautifully for some people. I am not one of those people, but it works beautifully for some people. A lot of the time, frequently, like Robert Whitaker says, I invite you to look up talks by Robert Whitaker. Psychiatric medication is like, if you have a car and it's low in oil, instead of opening up the oil, I'm not a mechanic. I might know neurology at this point, but I'm a horrible mechanic. I've never owned a car, so, but opening up the oil cap, no, you don't do that. Normally you get your oil changed. Okay, so windshield washer fluid. Okay, so psychiatric medication is like opening up the cap, instead of opening up the cap to the windshield washer fluid and refilling the windshield washer fluid, because we all agree that's how you refill windshield washer fluid. Instead, you open up the car hood and you take the windshield washer fluid and you pour it all over the engine and the windshield washer fluid cap. Do you get the analogy? So psychiatric medication is flooding your brain with serotonin, for instance, or because it blocks the serotonin reuptake receptors. And therefore, it might make parts of your brain happier and less anxious, but it also fucks up the parts that are like, whoa, we didn't need this serotonin. For instance, your gut. There's a lot of serotonergic production in your gut. A lot of the reason why when you start antidepressants, you get nauseous and you get diarrhea is because this is where it's manufactured. So if all of a sudden you're giving it a drug that causes increased production of serotonin, it's like, whoa, we got to go poo because this is just too much. Am I explaining this right? Am I explaining this accurately to you guys? Rim shot. I didn't know what a rim shot was for years, guys, and I thought it was related to rimming. I was like, rim shot? Rim shot? No, rim shot is boom. I'm crazy. I feel crazy right now. I honestly, it's so hard for my personality to be back. It's really intense because it wasn't here. Like I had no feelings. So it's like I have to get rebalanced and it's hard. Stop gluten, dairy, and sugars. Again, that's well-intentioned and I agree I should have less of them, but I got so dangerously thin. I don't know if you guys can't tell how thin I am now. Oh, I'm not. Oh, that looks bad. Oh my God. My underwear. I didn't realize my underwear is cutting into my butt. I'm not wearing a thong, so it's cutting into my butt. Oh no. Now I'm getting demonetized. Demonetized. For the 1 minute I showed you the fact that I'm wearing granny panties. See, that's how I'm out of it. Like this morning, you saw how bad I was. I didn't pair the right underwear with my leggings. Maybe I shouldn't even be talking about my underwear. But anyhow, I'll show you because you don't care about underwear. But please note that my butt isn't like that. That's my underwear. But my butt is flatter than it used to be because I'm so thin. Can you guys see how much skinnier I am? Like I'm still underweight. I was even worse than this though. I was like a twig. You could see all of my ribs. My hip bones were sticking out. Before I got hospitalized, when I got hospitalized in June, I looked like I was about to die. And I probably, in a way, even though hospitalization hurt me, it sort of helped me because they gave me 3 or 4 very large meals a day. And I ate the 4 large meals. And I think that helped. And it helped the friends that I made at the hospital. And it also helped. What did it help? It helped me to develop compassion for people suffering from psychiatric disorders. And it helped me to figure out what the flaws are with the psychiatric medical system, which because once I am well, or even when I'm not well, I am in a position of power, having a following that I can disseminate the message that will hopefully enact change for people suffering from mental disorders because they do not deserve to suffer as they do. They deserve more care. The way it works in our hospitals, they should not leave psychiatric patients alone without being checked up by medical professionals who are not psychiatrists at least once a week. And they should have a patient advocate that comes, again, twice a week within the hospital to listen to each patient and listen to their stories. And if there is abuse that's occurring, they fix it because abuse goes unchecked in psychiatric wards. And I was unfortunately the recipient of some maybe well-intended, but it was still abuse. I had a psychiatrist stand over me and tell me to stop acting up and stop having a seizure. And other nurses came up to me and said I was faking it. And they laughed at me. I had an orderly say to my face, everyone sees what you're doing right now and they're all laughing at you because you deserve to be laughed at. Do you understand how horrible that was? I was laying there dying on the floor and nobody would help me. I don't think you understand how horrible that is. And that shouldn't happen to anyone. I also saw them deny cardiac care to a woman with schizophrenia who clearly was having chest pains. No, it was not Rivière des Prairies. It was the Jewish General Hospital. I diagnosed the woman with schizophrenia. I could tell she was having heart problems. And so I told her, when you leave the hospital, because this is what psychiatric patients frequently have to do. I said, when you leave the hospital, please go to your GP and tell him that you're having chest pains and pain that's radiating down your left arm and that your face turns bright red and your heart races. Because that's what I took her pulse. It was racing. She was tachycardic. And I'm smart enough to know that means that she has cardiac problems. But yet the psychiatrist, although they weren't even the psychiatrist, because you only see the psychiatrist once or twice a week, sometimes daily, usually once or twice a week. The nurses wrote it off. It was like, they just like, it's heartburn. It wasn't heartburn. Is that the right term? I'm second guessing myself. Hold on. Tachycardic is the correct term. Tachycardia, but when you have the state of having tachycardia is okay, well, I don't know if it's tachycardic, but she had tachycardia. Just so that I'm precise, so I don't sound like, so I don't communicate improper information. So guys, this has been a ride. We're almost at 2 hours. I want to thank Efrain. I love you. Thank you for giving me a $10 donation. That helps me to survive because I can't make Patreon anymore. So my Patreon earnings are now 1/10 of what they used to be. So that's not so good. But I'm okay because I only pay $1,000 a month in rent, and food, I guess, is $500 or $600 a month. So I'm only, my expenses, if I don't buy any, okay, but maybe my expenses are like $2,000 or $2,500 a month. Okay, maybe I don't have enough money. So, so thank you, Efrain, for your kind donation. If anybody wants to donate before I leave, I'm leaving in less than 5 minutes because I need to lay down, even though I don't want to. I'll donate. Thank you, David. I didn't collect COVID benefits. I never collected COVID benefits. And you know what? Well, I don't know that I would qualify. But I think that if I get, as the doctor suggested, tested serologically for COVID, prove I had COVID, technically I should have gotten CERB benefits, but I never collected them because also I kept waiting every month to get better. And I was like, okay, surely this month I won't feel like I can't be myself. Surely this month my brain will work properly. Surely I'll be able to sleep soon. Nope. But nope. I can't wait to taper off my medication entirely. I really can't wait. And I have to go slow so I don't fuck myself up more. Because it makes me worse. Because when it peaks in the morning, I get worse. Because increased serotonin fucks me up more. Okay, so. No, well, it's not a lot left. Yeah, no. Sorry. I thought you said then a lot. Yes, a lot of people did leave my Patreon. I lost hundreds of people. I lost actually 400 people. So actually more than that. Yeah, no, I lost 400 people. But that's okay. I'll get them back if I come back. So rest a lot. It's needed. We love you. I love you guys too. Thank you for being with me. Please stay with me. I will try to broadcast as much as I can because this is part of my therapy. Part of my therapy is that I have to fight my own brain. So I have to retrain my brain to behave normally because it has electrical discharges that don't make sense. And so it goes, oh, you're supposed to do this. Face, go this way, as it's doing right now. Face, go this way. No, face. No, I can't do. I'm trying. Face, don't do that. Face, you're going to stop. Face, stop. Face. That kind of worked. Face, stop. Face, relax. Oh my God, this is freaky. I literally told my face to stop doing that. Okay, this is crazy. So he said that I had to repetitively train myself to be normal. And then my brain will stop being confused. Does that make sense? That it'll stop misfiring and going, do this. And it's like, that is not productive, brain. Brain, go back to normal. I have to overcompensate. And that's neuroplasticity. Yes, there you go, Adam. T'as raison. Le neuroplasticité. C'est exactement ça qu'il faut qu'on axe dessus. Et aussi, j'ai découvert que j'ai plus d'habilité à parler en français depuis mon maladie. Ça se peut que c'est parce que j'étais entourée de francophones, mais ça se peut que la région où se trouve le français dans mon cerveau, c'est plus intact. C'est aussi différent de où se trouve l'endommagement. Tu comprends? Exactly. Okay, yes, exactly. I have to do biofeedback. That's exactly what I have to do until I get better, but hopefully they're right. Again, there's a possibility that I will just get worse and I will drop dead, or I don't want to. Okay, see, I just stressed myself out. Okay, stop stressing out. Oh, I feel a whoosh. I'm going to have a seizure again. Okay, that was a small one. Pauline Marois peut embrasser mon cul. Non. Parce que je trouve son approche raciste. Raciste. Okay, il faut que je me calme. I have to calm myself down. I even tried speaking Spanish refrain to a nurse called Fernando. Me llamo Emmy. Hola. And he's like, what? I was like babbling and incoherent. I was like, see. But yet aware, but yet part of my brain was still aware that I couldn't control what I was doing. So part of my brain was like, why are you speaking in Spanish? Why are you babbling? Why are you saying me llamo Emmy? Like, it was just like, I would never have believed in a million. I would have laughed in your face if you would have told me that this was going to happen to me a year ago. I've been like, no, you're going to get a brain infection. Spinal fluid's going to leak from your nose and you're going to lose control of your body. And then you're going to try to fight it back. And half your brain's going to not work for 7 months, but then it's going to come back online. And then you're going to have to fight physical disability and seizures. I would have been like, shut up. I'm healthy. I eat keto. I work a lot. I take care of myself. You're full of shit. Well, look what happened. So we will end on that note. Thank you for watching. My name is Davison. I'm finally Davison. I am Davison again. I wasn't Davison for a long time. So I love you guys and I'll talk to you later.